There is a definite role for local treatment of metastatic disease. What do we mean by local treatment of metastatic disease? Sometimes patients present with disease that is already metastasized to the liver, to the lungs, or to other parts of the body. It is clearly been shown that in patients with only metastatic disease in the liver, there is a role for local treatment in addition to chemotherapy. Local treatment means that there is a role for surgically removing these metastatic nodules. Now, please remember, this is only applicable in colorectal cancer patients and only applicable in colorectal cancer patients where the disease is only to the liver and no other sites. If there are already lymph nodal metastases which are left behind, if there are peritoneal metastasis, bone metastasis, or lung metastasis, local therapy does not confer any advantage. Local therapy may also include radiofrequency ablation or cryotherapy. In the case of radiofrequency ablation or cryotherapy, a needle is inserted through the skin into the liver where the lesions are. And either by radiofrequency ablation, we burn these lesions, or in the case of cryotherapy, we freeze these lesions in order to eradicate the cancer cells. I know there are some institutions that are using these local therapies in a very liberal manner. Even in patients where disease has spread to various sites, they will do this cryotherapy in order to see temporary improvement in the disease. There has been no data to show that these patients who undergo cryotherapy in actual fact live longer than patients who don't go for cryotherapy.
When the tumor is small, we can actually do a very limited resection, preserving the breast. Sometimes when the tumor is large, we are still able to shrink it down first with chemotherapy, hormone treatments, or antibody treatments. So in more than half of these patients, we can effectively make the tumor small enough to allow a local excision to take place without sacrificing the breast. Some patients, and we have seen patients who are so concerned about losing their breast, and they seek other kinds of local treatment. One of the patients that I've seen myself, I actually gone for a cryotherapy for the tumor in the breast. So the breast was not removed, and the tumor was so-called frozen down. But after that, what we found was that the whole breast was so hardened because of the scarring that have taken place after the cryotherapy. And it also poses a problem as to whether there are still remaining cells inside, which is difficult to determine when the tissue is so scarred. So eventually this patient still had to go for a mastectomy because just to be sure that all the tumor cell has been eradicated.